consistent challenge we have as far as the whole education and messaging and some of the research that's been done in Europe and Africa and Asia really shows, for lack of a better term, kind of a lack of sensitivity that many times patient and caregivers feel they're being talked down to and not respected. So I think one of the things that we need to remind ourselves as researchers or clinicians or healthcare providers is that it's not our job to impress people with jargon and fancy terms. It's our job to show our intelligence by making the complex seem simpler, by demystifying, the maze of the Alzheimer's challenges and contributing factors to Alzheimer's disease. So really on an individual basis, just treating people with respect and most importantly, early on, listening carefully to what their concerns are. I know it's a cliche, every patient is different, but it's true. And so are the caregivers' fears and concerns. As recently as probably 10 years ago, a lot of people didn't even want to know they had Alzheimer's because they felt there was nothing they could do. And even today, there's a large percentage of people who say they'd rather not know. And even today, there's a large percentage of physicians who would rather tell a patient they have cancer than they have Alzheimer's because they still feel, well, there's nothing that's going to work. The medicines won't help. There's nothing we can do to change it. And we're learning now that there are things we can do. There are modifiable risk factors. There are things we can do to help patients on a one-by-one basis, including and especially their caregivers as well.